What's up, guys? I'm Jocelyn, also known as the Vagina Doc from the Vagina Doc Physical Therapy and Wellness. And in this video, I'm going to teach you how to test your abdominal strength. I'm going to show you 3 different ways to test different layers of your abdominal wall. The first test is going to be called a trunk curl up, and this is primarily testing your rectus abdominis strength. The second test I'm going to show you is the leg lowering test, and this is also a rectus abdominis test in addition to testing your hip flexors. And the third test I'm going to demonstrate will be the alternating leg lift test, which will test your rectus abdominis, your obliques, and your transversus abdominis. Few things to talk about before I begin showing you these movements are principles to progress. First thing is, in order to progress, you cannot be symptomatic. When I'm talking about symptomatic symptoms, I'm referring to vaginal pressure, diastasis recti, coning. So what that is when you see a coning or a doming through the space between your six-pack muscles. Pain in your back, hips, anywhere, in addition to pain or symptoms afterward. Other symptoms that you may experience would be leaking urine upon lifting up your trunk or lifting up your leg. That also is a sign of dysfunction, and in that case you would not progress, you would regress. Other principles for these tests. To go up a level, you would want to do at least 3 successful reps before moving on to the harder level. So when I show you the third test, we're going to start from easy to hard, and I am not going to demonstrate 3 proper reps, but you would do 3 proper reps before you test up in the next level. The first test I'm going to show hardest to easiest, and in that case you want to do 3 proper reps before going up. And if you're testing the same way that I'm going to do it, meaning starting with your fingertips up here rather than by your side, you would want to scale back to level 2, the intermediate level. If you can't do 3 reps properly, go to the next level down, and then from there you may need props such as more pillows or ab mats to put you in a gravity lessened position so it's easier. Other principles here are where you should feel these movements. You're going to feel these movements in the front of your abdominal wall and not your back. So if you're feeling them primarily in your back, then there might be an issue with the way you're recruiting your abdominals. How I instruct these tests depends on who I'm seeing and what their history is. But in general, even if I'm testing the upper abdominals, I do teach my clients, depending on their history, most often teach them how to engage their deep core first and then proceed through the test. I will mention that in a moment. And let's say you've done the test, you establish which is the appropriate difficulty. How many repetitions should you do before you bump up a level? My suggestion is to do at least 10 reps, 10 to 20 reps before you bump up. All right, let me get started showing you each of these tests. So the first test is the trunk curl up. You're going to lay flat on your back, and the easiest would be right where I am, and the hardest level, which I am going to start, is your fingertips are at your temples. Now, you start from your head and your neck, and then you roll up segmentally until you're in the upright position. What you don't want to do is use momentum from your hips or sort of hinge up, which I will demonstrate in a moment. So fingertips to temples. I'm going to tuck my chin and roll up segmentally like this, and then I'm going to return just as I came up, so segmentally. The last thing that goes back is my head and my neck. I'm going to repeat that 2 more times. Now, what I typically coach is I would like my clients and athletes to draw their belly button inward towards their spine. Sometimes I cue a Kegel as well. And then I have them exhale that. We're going to go to level 2. So let's say we're at level 3, we're at level 2 now, which your arms cross in front of your chest, and we do the same thing. Chin tucks, head lifts, come up, and then come back down. And then you would see if you could do that 2 more times. Let's say you can't, then your hands go by your side, and this is the movement. Here are things to look out for. That would be a no rep. That's really a very common one. The other one would be losing the control on the way down. So really think about, and that would not count as rep, think about keeping your chin tucked the whole way until you get back down. Now to train this differently, this would be advanced. I would have my athletes breathe in on the way up and breathe out or in on the way down, and that would be a completely different goal. My requirements would be the same. You've got to keep the deep core engaged, no coning, no pressures, no symptoms during or after. Options, if you are not able to lift your head up, if you can't, let's say you don't have the strength in your deep neck flexors, then you can use a pillow. Let's say that you have a big rib cage flare here, then I would put a pillow underneath your head and at the top of your shoulders. Okay, test number 2 is the leg lowering test, and this test is a great one to check out before you do something like a hollow body rock or a V-up sit-up. And the principles apply as I just mentioned before I demonstrated the other test. You're going to start on your back here, and your feet are going to be up like this. So I would have you establish a deep core brace and then almost think about flattening your back into the table, not with your glutes, more so with your abdominals. And then you're going to slowly lower your legs, keeping your back position the whole time. The goal would be to get to the further you get to the surface, the better off. It's really great if you have a partner to make sure that you're not moving in this area in your lower back or right at the top of your pelvis, because that would indicate that the test is over, and we would retest and see where it is that occurred. Things to look out for is as you go down, your back starts to arch, or you're holding your breath on the way down, or you comb through your abdominal wall. Now, case-by-case basis, I allow more or less tightening of the glute muscles, because you do need them to some degree. They play a synergistic role with your abdominals. But if that's all that you're doing and you're not keeping your abdominals engaged, then I would say that this is too difficult at this time. So a regression to this would be here. But at that point, if you are unable to do this with your legs straight, I would be more cautious in progressing you back to something like a toes to bar, a strict toes to bar progression. Test number 3 is going to be the alternating leg lift, and then it progresses up to a double leg lift and lower. I'm going to start by demonstrating the easiest option first, and then I will progress from there, as opposed to the first test I started from the hard, and then I progressed to the easiest. You're going to lay down again, and this is your starting position. You're going to hold one hip towards your chest, and then the other leg is down like this. Now, you want to find a neutral position of your spine, and in that position, you're going to gently contract your deep core muscles, and then slowly lift one leg up, and then one leg down. You're going to repeat that 3 times. Or, when your leg gets up, you just pass it off, and then repeat on that side, so that you're alternating. And if you could do that 3 times per side without your back moving or your belly pooching upwards, then I would progress you to the next level. So things that you're looking out for that I didn't mention earlier is that moves, if it arches or it rotates, then that is considered a movement fault. So I would have you redo the rep and try to get you to do it better. I'd also look for as if when your leg lifts, does your belly button lift up? If it does, what is happening is the upper abdominals are dominating, and at this point, I want you to really focus on obliques and transversus abdominis, so I would consider that is a no rep, and we would train that right then and there. So level 2 now is that you're starting in this position, and one leg moves up, then the other leg moves up, and then the first leg returns down, the second leg returns down. Still looking for the maintenance of your belly button in towards your spine, still looking for a straight back. So I would repeat that 2 more times, leading with this side, and then I would switch. So I'm going to use my right, I'm going to start with my right, I'm going to lift, and then lower. This one's pretty challenging for me. That would be considered 1B. And 1A is going to be the next level up, and the difference here is 1B, you go past 90 degrees, and 1A, you just go up to 90 degrees. So that looks like this. I repeat that 2 more times on this side, and then I'm going to repeat that 3 times on the opposite side. Level 2 now. What you're going to do is one leg, I gotta think about this. We're going to start from this position. So hips at 90, I'm going to find my neutral spine. You're going to lower one leg, slide it out. Your foot is in contact with the surface. Slide it back in, and then return to the starting position. Then you do that 2 more times, making sure that your belly button stays down, and that your back isn't moving. And then the other side does it 3 times. So if you could do that 3 times on each leg, then you would proceed to the next level, which is level 3. So here, your leg lowers, and then extends outward, not touching the surface, pulls back in, and returns to the starting position. And then the other side goes, and comes back in. And you would do that 3 times per side. If you could do that 3 times per side, keeping everything still, not holding your breath, no symptoms, then you would progress to the next level. That would be level 4. Both legs, so you establish neutral spine. Both legs tap the surface, slide back in, and then come back up. You would repeat that 2 more times. So down, slide, and then back in. Level 5 now would be you're not tapping, you're extending, you're coming back in, and you're at the starting position. You do that again. And then you do it a 3rd time. This last level is similar to the leg lowering test, and that really reflects on your readiness to progress to something like a hollow body or a V-up. I think that is it. 3 key tests. If you notice that there's an asymmetry when you're doing the 3rd test between ease of lifting one leg first versus the other side, then maybe there's an asymmetry in your obliques, and then I would test your oblique strength from there. I am not going to go over that video here, but that could be something that, if you're interested, we go over in future videos. So thank you guys for watching. If you have any questions, reach out to me either in the comments or send me an email, and I will get back to you as soon as I can. Thank you for watching.